This video will walk you through the basics of prescribing and sending e-prescriptions. Specifically, the video will cover adding pharmacy information, configuring the prescription preferences, prescribing, renewing, and discontinuing medications, on-demand drug interactions, sending e-prescriptions, as well as handling refill requests and errors. When you have finished watching this video, you will have a general understanding of how prescriptions work and be able to prescribe, renew, and discontinue medications, send e-prescriptions, and handle refill requests. ChartMaker Clinical is connected to SureScripts Rx Hub for e-prescribing. SureScripts Rx Hub provides a list of over 95,000 pharmacies countrywide which they can e-prescribe. However, practices use pharmacies in their local area and do not need to view the entire list. The clinical application thereby gives you the option of creating a list of pharmacy favorites for your practice from which you can easily view and select. To add pharmacy favorites for your practice, open a patient's chart and then click the ID tab. In the ID tab, scroll down to the pharmacy field and then click the Pick button. This opens the pharmacy selection dialog. In the Practice Pharmacy Favorites section, click the Practice Pharmacies button. This opens the Favorite Pharmacy Selection dialog. Here you can search for pharmacies by the pharmacy name, city, state, zip code, and/or by the pharmacy type. For our example, we'll type in the first few numbers of the zip code and then click the Search button. The system will then display below all of the pharmacies to which SureScripts Rx Hub subscribes within the parameters of the search criteria entered above. To the right, you will see any pharmacy favorites that have been selected for the practice. To select the pharmacy to add to the practice favorites, locate the pharmacy you want to add, and then highlight that pharmacy. To the right, the applicable pharmacy information will be displayed. Pay special attention to the service level for the pharmacy, as this will display what services are available for this pharmacy. To add this pharmacy to the practice favorites, click the Add button. You will now see the selected pharmacy added to the favorites list. You can then add additional pharmacies as needed. When finished selecting favorite pharmacies for the practice, click the Apply button, and then click the OK button. In the Pharmacy Selection dialog, you can see the pharmacies that were added in the Practice Pharmacy Favorites list. You can then click the OK button to exit this dialog. To add pharmacy information for a patient, open the patient's chart and then click the ID tab. Scroll down to the pharmacy field and then click the Pick button. This opens the Pharmacy Selection dialog. In the top left of the Pharmacy Selection dialog will be listed any manual pharmacies that cannot be used for e-prescribing, and in the bottom left is a list of practice pharmacy favorites which can be used for e-prescribing. Select the applicable pharmacies for the patient. The pharmacy information will then be displayed to the right in the Pharmacy Information section of the dialog. To add this to the patient's pharmacy list, click the Add button. You can then select any other applicable pharmacies for the patient. When finished selecting pharmacies for the patient, click the Apply button, and then click the OK button. In the ID tab, you will see that the pharmacies will now populate the pharmacy field. If there are multiple pharmacies, you can select a default pharmacy for the patient. Once a pharmacy has been selected for the patient, be sure to click the Save Chart button. There are a number of preferences that can be configured regarding prescriptions, such as the level at which drug interactions take place, the default destination for prescriptions, whether they will be printed or e-prescribed, as well as who will receive any unmatched refill requests for e-prescriptions. To configure these preferences, click the Edit menu and then Preferences. In the Preferences dialog, click the Prescription tab. Toward the middle of the screen is a Drug Interaction Setting field. You have the option of selecting None, Contraindicated Only, Contraindicated and Severe, or Contraindicated, Severe, and Moderate for the level of drug interaction warnings you would like displayed. Next, in the default destination field, click Printer or e-prescribe to select the default method in which the prescriptions will be printed or sent. This setting can be overridden on an individual basis by selecting a different method via the patient's face sheet when printing or sending a prescription. In the ERX Default User Receive Unmatchable Refill Requests field, you can select the user who will receive the unmatched refill requests by clicking the drop-down list and selecting the applicable user. Once the applicable preferences have been configured, click the Set button and then click the OK button. Medications can be prescribed for a patient in a chart note or from the patient's face sheet. To prescribe a medication for a patient in a chart note, open an existing or new chart note for the patient, click the medication button, and then select Add Medication. This will open the Find Medication dialog. To prescribe a medication for a patient from their face sheet, open the patient's chart, and in the face sheet, click the asterisk button next to the Add Medication. This will open the Find Medication dialog. In the Find Medication dialog, you are able to search for medications, select a recently prescribed medication, select a medication from a prescription category, add a new medication, should a particular medication not be in the first databank, create a prescription category, or view any inactive medications that are contained within your search. The Recent button in the Find Medication dialog will display the 33 most recent medications prescribed. If the medication that you wish to prescribe for the patient is in the list, simply highlight that medication and then click the Select button. Likewise, you are able to select different user-defined categories by clicking the appropriate category button, in our example, MH, vitamin, or diabetes. You can add or modify up to 3 additional categories by clicking the Manage button. You are not allowed to change the Recent category. Medications are added to and removed from these categories by right-clicking the medication and then choosing the Add To option and selecting the applicable category when adding, or clicking the Remove to delete the medication from the category. When removing, you need to be in the selected category. You cannot remove medications from the Recent category. You have the ability to manually add a medication by clicking the Add New button and entering the proper medication information. Do note, however, that the drug interaction information will not be available for manually entered medications. When the medications are displayed, any manually added medications will have an M beside them. To search for a medication, type in the first few letters of the medication and then click the Search button. The system will then display the results of your search. The Inactive Meds button will become accessible when your search criteria contains any medications that have no active forms and have been retired, replaced, or are inactive and thereby discontinued. If you click the Inactive Meds button, a Discontinued Medications dialog will appear listing all of the discontinued medications that are contained in your search criteria. To select a medication, highlight the applicable medication and then click the Select button. In the Prescribe Medication dialog, the information for the medication will be populated. Controlled substance medications will show the particular schedule type in parentheses prior to the medication name. Generic drugs will appear with generic attached to the end of the drug name, while over-the-counter drugs will be appended with an OTC at the end of the drug name, and brand drug names will have the additional brand text attached. If the Inactive Meds button is accessible, there are variants of the medication that have become inactive, replaced, or retired. To view the inactive, replaced, or retired forms of the medication, click the Inactive Meds button. The information displayed in the Inactive Forms dialog is for informational purposes only. You cannot prescribe from this area. If you would like additional information about the medication being prescribed, you can click the Medication Info button at any time. Once the medication information is displayed, you have the option of printing it. Please note, however, that this information comes from First Data Bank. Therefore, manually entered medications will not include this information. The Medication History Consent button displays the patient's current level of consent and allows access to the consent dialog to configure consent. In the Medication History Consent section of the Consent dialog, you can configure a patient's consent for electronically accessing their medication history via ShareScripts network stored in the databases of community pharmacies and pharmacy benefit managers. Once consent has been configured as desired, you have the ability to configure a date of consent. And if consent was given, you can select a specific provider for whom consent was given, or you can select all providers. In addition, the two yes options in the consent dialog will be different based on the patient's age. For patients 18 years and older, the options will be yes, consent given, and yes, guardian POA consent given. For patients younger than 18 years, the options will be yes, parental guardian consent given, and yes, emancipated minor consent given. When finished configuring consent, you can click the OK button. You can also view the medication eligibility or medication history for this patient by clicking the respective buttons if this patient has a prescription plan. These buttons become active only if the selected patient has a prescription plan. Clicking the Medication Eligibility button will display the medication eligibility for this plan, while clicking the Medication History button will display any medication history of the patient based on the insurance over the last 2 years. The Formulary section of the Prescribed Medication dialog will contain any formulary information, including the medication selected, what the coverage would be, if there is any copay, as well as a list of preferred drug alternatives, if this patient has a prescription plan. You can select the payer in the corresponding field, if applicable. To configure the prescription information for the selected medication, we'll focus on the left side of the Prescribed Medication dialog. If there is an alternative, or in this case a generic form of the medication, it will be listed below the drug name, and you have the ability to select the drug by clicking that button. When clicking the respective button, you will notice that the drug will now be listed above as the medication you are prescribing, and the previously selected medication will be displayed below, allowing you to choose that form of the drug if needed. The first route drop-down list will display any methods of administering the selected drug and also acts as a filter for the route form drop-down list just below. The route form will depend upon the route selected in the field above. For example, we have all selected, so we are viewing all forms of the drug. If we change the route to oral, you will see only the tablets in the drop-down below. Here we are going to select the 0.5 mg tab. Next, we need to select the action. It defaulted to take, which is what we want to have here, and then we can select the dose, and the dose unit is pre-filled as tablet, and then we can select the frequency as needed. We'll select every day. In the dispense field, we enter the amount or quantity of medication to dispense for the prescription, and then click the adjacent drop-down list to further qualify the amount or quantity. In the Additional SIG field, enter or select any additional free text information that needs to be attached to the SIG. When information is entered or selected in this field, the SIG field will automatically be populated with the text. Do note, however, that there is a 140 character limit to the entire SIG field, the original SIG plus any text entered in the additional SIG field. You have the ability to create and modify predefined additional SIG text by clicking the Edit button. This allows you to configure consistent, structured additional SIG text while prescribing and renewing medications. Next, we select the number of refills for the prescription. Check the Substitution OK option to remove the DAW from the Dispense as Written box on the prescription. The Days Supply field should contain the number of days for which the patient will have an adequate supply of the medication prescribed. Whenever the dose, frequency, dispense, and refill fields have been entered, the Days Supply field will be automatically calculated. The calculation does not occur if a previously saved medication already had a day's supply value. However, calculation resumes once one of the aforementioned fields are modified. Likewise, if you modify the day supply field, then the field is not recalculated until the next time the prescribed medication dialog is accessed. Enter or modify the day supply as needed. Next, we can enter any maximum dosage if applicable. In the Notes to Pharmacist field, enter any additional information you wish to document regarding this prescription. Check the Save Notes option to save the notes for future prescriptions for this patient. You can then click the Dose Calculator button if you need to access the Dose Calculator dialog that allows you to enter proper dosage information along with the drug concentration and calculate the proper dosage based on the patient's weight. To the right in the Transmission field, the method of transmission configured in the preferences will default into this field. However, you have the ability to override this and select Hand Prescription to the Patient or e-prescribe, depending upon the manner in which this specific prescription will be transmitted. A diagnosis can also be attached to the drug being prescribed if applicable. When you click the drop-down list, the diagnosis will contain any diagnoses that are on the patient's face sheet. If another diagnosis needs to be selected, click Other, and the Diagnosis Search dialog will appear that allows you to perform an ICD-10 search, an ICD-9 search, or use the crosswalk feature to locate and select the diagnosis that should be attached to this prescription. If a diagnosis is selected, it will be appended to the end of the SIG or notes when the prescription is printed or sent. If you are giving the patient a sample, you can check the sample box and then enter a lot number and expiration date in the corresponding field. When this option is selected, the face sheet will display that this was a sample by having the word sample written into the drug name. When a medication has been administered during the office visit, you can check the Administered During Visit option to indicate this. At this point, we can enter or modify the started and or ended date for this medication as needed. Then you can enter or modify an earliest fill date if needed. The earliest fill date field allows you to configure the earliest fill date for Schedule II controlled substances. This field is required whenever you prescribe a Schedule II controlled substance. This field is also enabled when prescribing non-Schedule II medication, but is not required for those medications. You can then check the Initial Order Created Outside of Clinical option if the initial order for this medication was generated outside of the clinical application. When this option is selected, the medication will not be included within the numerator for the CPOE query for meaningful use Stage 2. Once all of the prescription information has been entered, it is recommended that you review the information in the SIG field for accuracy and to be sure there is no conflicting information. The SIG field contains the concise instructions for administering the drug to the patient as it was configured in the action, dose, dose units, frequency, and additional SIG fields above. This is the information that the pharmacy receives for filling the patient's prescription. After the SIG field is reviewed and is correct, click the Next button. When configuring the prescription information, if there is any applicable drug-to-drug, drug-to-allergy, or drug-to-disease interaction warning, an interaction present dialog will appear outlining the warning. Remember, these warnings will not appear with any manually entered drugs. Likewise, the information presented in the interaction present dialog is meant to supplement, not substitute, for the expertise and judgment of the healthcare professional. It is not intended to cover all possible uses, directions, precautions, drug interactions, or adverse effects, nor should it be construed to indicate the use of a particular drug is safe, appropriate, or effective. Interactions listed here are based solely on a formulation's active ingredients. Interactions listed in red are contraindicated, orange are severe, yellow are moderate, and those medications that may cause an allergic reaction will show up in blue. To view the monograph of a particular interaction, double-click the interaction. When finished reviewing the monograph, click the OK button. At this point, you have the ability to click the Revise button to return to the prescribed medication dialog to change or cancel the prescribed drug, or you can override this alert. To override the interactions present warning, you need to enter or select a comment. The comment will then be inserted into the chart note. If a comment is not entered or selected, a warning dialog will appear and you will not be allowed to proceed until a comment is entered or selected. Also, you have the ability to create and modify predefined comments by clicking the Edit button. This allows you to configure consistent, structured comment text when overriding various drug interactions. Once a comment has been entered or selected, click the Proceed Anyway button to continue with the prescription and override the warning. In the Confirm Prescription dialog, the medication information, along with all information that will be included in the prescription, will be summarized, offering you the opportunity to review this information before you confirm the prescription. It is recommended that you pay particular attention to the information in the SIG field for accuracy. The SIG field contains the concise instructions for administering the drug to the patient as it was configured in the prescribed medication dialog and summarized in the medication section of the Confirm Prescription dialog. This is the information that the pharmacy receives for filling the patient's prescription. If you need to change the prescription information, click the Revise button. This will take you back to the prescribed medication dialog. If the Administer During Visit option is checked in the Confirm Prescription dialog, the prescription section will be grayed out and will not be able to be queued to print or e-prescribe. Once confirmed, the medication will appear in the note and patient's face sheet with an Administer During Visit note beside the medication. When prescribing controlled substances, the location field will become active when there are multiple locations, allowing you to select the proper location and thereby the applicable DEA number when sending the e-prescription. With the implementation of EPCS, each provider or practice location has a DEA number attached to it. You can then modify the prescription destination if needed. If the destination is set to e-prescribe, you must select a pharmacy before you can confirm the prescription. If the pharmacy is not listed in the pharmacy dropdown, you can click the Manage Patient Pharmacies button to find and select the applicable pharmacy for the patient. To confirm the prescription, if the destination is hand prescription to the patient, click the Confirm button, or click the Confirm and Send button if the destination is e-prescribe and you are sending a non-controlled substance medication. If the destination is e-prescribe and you are e-prescribing a controlled substance, you must complete the two-factor authentication protocol. To do this, check the Ready to Sign option, which will activate the Sign and Send button. You must now have your IdenTrust token plugged into your computer. Once the token is plugged in, click the Sign and Send button. The system will then validate the security certificate with the IdenTrust token inserted into the USB port of your computer. If the certificate and token match, you will be prompted to enter your token password. Once the password has been entered, click the OK button. The system will then send the e-prescription, append the note or generate a drug log, and then update the medication list in the patient's face sheet with the prescription information. Medications can be renewed for a patient in a chart note or from the patient's face sheet. To renew a medication for a patient in a chart note, open an existing or new chart note for the patient, click the Medication button, and then select Renew Medication, and then select the medication you want to renew for the patient. This will open the Prescribed Medication dialog. To renew a medication for a patient from their face sheet, open the patient's chart, and in the medications list, in the face sheet, click the asterisk button next to the medication you want to renew, and then select Renew Prescription. This will open the Prescribed Medication dialog. In the Prescribed Medication dialog, the information for the medication will be populated as it was previously prescribed for this patient. You can modify any of the medication information as needed. Likewise, all of the functionality when originally prescribing the medication is available when renewing the medication. When the prescription information has been added or modified as needed, click the Next button. As when prescribing a medication, if there are any applicable drug-to-drug, drug-to-allergy, or drug-to-disease interaction warnings, an Interaction Present dialog will appear outlining the warning. As before, you can enter or select a comment to override the warning, or click the Revise button to return to the Prescribed Medication dialog and change or cancel the prescribed drug. As when originally prescribing a medication, the Confirm Prescription dialog will display a summary of the prescription information, offering you the opportunity to review the information before you confirm the prescription. If you need to change any of the prescription information, click the Revise button. This will take you back to the Prescribed Medication dialog. When prescribing controlled substances, the location field will become active when there are multiple locations, allowing you to select the proper location and thereby the applicable DEA number when sending the e-prescription. You also have the ability to change the destination if needed. If the destination is set to e-prescribe, you must select a pharmacy before you can confirm the prescription. To confirm the prescription, if the destination is hand prescription to the patient, click the Confirm button, or click the Confirm and Send button if the destination is e-prescribe and you are sending a non-controlled substance medication. If the destination is e-prescribe and you are e-prescribing a controlled substance, you must complete the two-factor authentication protocol. To do this, check the Ready to Sign option, which will activate the Sign and Send button. You must now have your IdenTrust token plugged into your computer. Once the token is plugged in, click the Sign and Send button. The system will then validate the security certificate with the IdenTrust token inserted into the USB port of your computer. If the certificate and token match, you will be prompted to enter your token password. Once the password has been entered, click the OK button. The system will then send the e-prescription, append the note or generate a drug log, and then update the medication list in the patient's face sheet with the prescription information. Medications can be discontinued for a patient in a chart note or from the patient's face sheet. To discontinue a medication for a patient in a chart note, open the existing or new chart note for the patient. Click the Medication button and then select Discontinue Medication, and then select the medication you want to discontinue for the patient. This will open the End Medication dialog. To discontinue a medication for a patient from their face sheet, open the patient's chart, and in the medications list in the face sheet, click the asterisk button next to the medication you want to discontinue, and then select Discontinue Prescription. This will open the End Medication dialog. Once the End Medication dialog opens, you can select a reason why the medication was discontinued for the patient. Next, in the End Date field, modify the date and time as needed. And then you can enter any free text comment as needed. When finished, click the OK button. The system will then append the note or generate a drug log with the discontinuation information, remove the medication from the medication list in the face sheet, and also update the patient's history tab with this information. Once a medication has been prescribed for a patient, you have the ability to view any drug-to-drug, drug-to-allergy, or drug-to-disease interactions for the patient for that medication via the Medication Interactions option in the medication menu on that patient's face sheet. In the medication list or pre-existing meds list of the patient's face sheet, click the asterisk button to the left of the medication you wish to view drug interaction information for, and then click the Medication Interactions option. If there are any interactions, they will be listed in a similar manner as they were when prescribing the medication earlier in the video. To view the monograph of a particular interaction, double-click the interaction. When finished reviewing the monograph, click the OK button. When finished viewing drug interaction information, click the OK button and you will return to the patient's chart. Prior to sending e-prescriptions, there are a number of required items that need to be configured for the prescribing provider as well as the patient. The system will not allow you to send e-prescriptions until these items are entered. For the provider, you need the practice ID, the MPI number, their first name, last name, phone number, street address, city, state, zip code, and user ID. The user ID information is automatically entered by the clinical application, while the other information is either entered for the provider in the provider system table or in the practice manager application. For the patient, you need to enter their first and last name, their date of birth, gender, phone number, street address, city, state, zip code, and patient ID or account number. This information is entered in the ID tab of the patient's chart or in the practice manager application. Prior to sending e-prescriptions for a patient, you have the ability to view the pharmacy that the last e-prescription was sent to for a particular medication. To view this information, click the asterisk button next to the applicable medication and then click Last e-prescription Pharmacy. The pharmacy name, address, phone, and the date of the last e-prescription will then be displayed. Prescriptions for controlled substances are sent electronically as they were before in previous versions. However, there are some additional changes that were made to adhere to the updated security when sending controlled substances that we will now cover. Once the controlled substance has been queued via the face sheet, you can click the asterisk button again and then click Send e-prescriptions. Do note, however, that you can only send one controlled substance at a time. If you try to queue another medication once a controlled substance is queued, or if you try to queue a controlled substance when other medications are queued, the system will not allow you to continue until the controlled substance is deselected or the other medications are deselected for sending. In the Send e-prescriptions dialog, if you are sending controlled substances, the location field will become active when there are multiple locations, allowing you to select the proper location and thereby the applicable DEA number when sending the prescription. In the e-prescriptions for section, the controlled substance medication, in this case Ativan, will have a green check mark next to it. In the pharmacy selection section, highlight the pharmacy you want to send the prescription to. When sending controlled substances, the selected pharmacy must allow the e-prescribing of controlled substances. When you are sending a controlled substance, you must complete the two-factor authentication protocol. To do this, check the Ready to Sign option, which will activate the Sign and Send button. Also, the green check mark next to the controlled substances will change to a checked clipboard icon. You must now have your IdenTrust token plugged into your computer. Once the token is plugged in, click the Sign and Send button. The system will then validate the security certificate with the IdenTrust token inserted into the USB port of your computer. If the certificate and token match, you will be prompted to enter your token password. Once the password has been entered, click the OK button. The e-prescription will then be sent to Surescripts Rx Hub and then to the selected pharmacy. When using electronic prescriptions, you may often receive refill requests, as well as occasionally receiving unmatched refill requests and errors. This section of the video will walk you through handling these refill requests and errors. When a patient goes back to the pharmacy to ask for a refill for their medication, the pharmacy sends an electronic prescription refill request. That refill request comes back to the provider's to-do list. The to-do list message will have a subject of electronic prescription refill request, as well as showing the date, priority, and type of item. To process this refill request, double-click this entry to open the patient's chart. In the patient's chart, you will see the medication has refill next to it. Here, simply click the asterisk button next to the medication and select Process Refill Request, and the Refill Response dialog will appear. In the Refill Response dialog, if you are refilling a non-controlled substance, enter the total number of dispensings approved and then click the Approve button. This will delete the refill reminder from your to-do list and send the applicable refill information for the patient. If you are refilling a controlled substance, enter the total number of dispensings approved, select the proper DEA number, and then you must complete the two-factor authentication protocol. To do this, check the Ready to Sign option, which will activate the Sign and Approve button. You must now have your IdenTrust token plugged into your computer. Once the token is plugged in, click the Sign and Approve button. The system will then validate the security certificate with the IdenTrust token inserted into the USB port of your computer. If the certificate and token match, you will be prompted to enter your token password. Once the password has been entered, click the OK button. This will delete the refill reminder from your to-do list and send the applicable refill information for the patient. To deny a refill request, enter a comment in the corresponding field as to why the request is denied, and then click the Deny button. This will close the Refill Response dialog and delete the refill reminder from your to-do list. To deny a refill request and prescribe a new medication, click the Deny New Rx to Follow button. This will open the Find Medication dialog, allowing you to prescribe a medication as it is typically performed. Once the new medication has been confirmed, you can then send e-prescriptions. After this process has been completed, the refill reminder will be deleted from your to-do list. Also, if you renew or discontinue the medication, the refill reminder will be deleted from your to-do list. An unmatched refill request will typically appear in a provider's to-do list, either because a refill request is received that cannot automatically be matched to a patient, or because a patient does not have the requested medication attached to their chart and in their face sheet. If the unmatched refill request appears in the to-do list, you have the ability to manually match this refill to the correct patient. To do this, double-click the Unmatched Refill Request entry, and the Match Refill Request dialog will appear. In the Refill Request Information section on the left of the Match Refill Request dialog, the information regarding the request will be displayed. The patient name, gender, date of birth, the drug, any additional drug information, the pharmacy information, as well as the prescriber. It is recommended that you make note of the medication information and the applicable pharmacy information. On the right side of the screen, you are able to search to see if the applicable patient for this refill request is in ChartMaker Clinical. If you type the first few letters of the patient's last name, the system will return those patients that meet the search criteria. If the applicable patient is in the system, highlight that patient, and then in the Select Patient Medication list below, highlight the applicable medication, and then click the Match button. This will match the patient to the refill request, and then create a refill request reminder for the patient, allowing you to process the refill request as we covered earlier. If the unmatched refill request was sent in error, and there are no applicable patients to which the request matches, or if the medication that is being requested for the refill is not in the patient's face sheet and is therefore not attached to the patient's chart, or you want to deny the request for some other reason, click the Deny Request button, and then a denial reason pop-up will appear, and you can then enter a reason for the denial. When finished, you can click the OK button, and the unmatched refill request will be removed from the to-do list. Occasionally, you will receive an electronic prescription error. These errors may happen for a number of specific reasons, but typically have to do with connectivity problems, or if any information sent does not match the pharmacy information. To process an error, double-click the electronic prescription error in the to-do list. This opens the applicable patient's chart. In the patient's chart, you will see the medication has error next to it. Here you simply click the asterisk button next to the medication, and then depending upon the specific error, you can either requeue the medication for e-prescribe, renew the prescription, or discontinue the prescription as needed. This concludes the ChartMaker e-prescriptions video. For more detailed information on prescriptions, consult our online help system by clicking the F1 key when in ChartMaker Clinical. To replay this video, click the replay button.